and myself. These slides in their recorded version will be sent out to all of the individuals who are invited to this webinar. And then obviously, if you guys have any questions that pop up afterwards, please feel free to reach out to us, to give us a call, send us an email with those questions. So let me begin. Today, we're going to address 11 different topics. What is the current situation of COVID-19 in Fairfax County? How infection of COVID-19 is spread? What are the symptoms? And specifically, what are the symptoms that we're generally seeing among children? What happens if you have a student who's ill or a staff member who's ill, and what they need to provide to return to school? What should you do if you're notified of a case amongst a student or staff member at your school? What will the health department do in our investigation of a student or staff member? What are effective approaches in your schools to prevent transmission? Are there any activities that are more or less risky in the school environment? What do we know about children spreading COVID-19? What do we know from schools elsewhere across the country? And what lessons have we learned so far in Fairfax County dealing with children in school and transmission and outbreaks that we've seen so far in Fairfax County? So we'll hopefully jump into all of these issues. And again, I implore you, please ask questions as they come along. I have individuals here in the room with me that will be reviewing the chat box to make sure that we'll address your questions as soon as you type them in. And just before we get started, just want to make sure one more time, everyone can see the slides and can hear me clearly. If you could just chat in a yes, that'd be great. Great. So I'm sure a lot of you are opening up from the fall. And just before we get into our slides, really into the meat of the presentation, wanted to talk to you all about some measures that you can put in place, just general measures that should be your guiding principles to all the decisions that we're going to be making over the course of this pandemic. The first is we want to minimize risk as much as possible in the school setting and throughout our community. And that can be done by using cloth face coverings. We want to maintain physical distancing and social distancing as much as possible. We want to enforce and really educate individuals on the frequency and the quality of hand washing. And we want individuals, students and staff members, to stay at home if they are sick. We don't want individuals obviously ill in our community. The other thing we really want to enforce is we want to appropriately and consistently manage staff and students who have COVID-19. So we want to treat everyone obviously very equally. We want to ensure that we're doing the proper measures for all individuals who have COVID-19 to ensure the safety of our community. We want to take a look at what's worked in the past. We want to use our data, and we want to make the strongest decisions possible moving forward. And then, as you all are aware, the last bullet here is crucial for any school setting. We want to maintain open communication lines. We want to be as transparent as we can with our school communities, with our families. And we always want to maintain good communication between public health and your school leadership. So jumping into our first question, the current situation of Fairfax County, you can see our case counts here. So there are two figures on the screen. On the left of the screen is the Virginia case counts. On the right of the screen is our Fairfax County case counts. You can see from the Virginia case counts, a first peak was seen in the end of May, early June. And then they've seen kind of steady to high transmission throughout the Commonwealth of Virginia, all through the end of late summer through now, with a recent decline seen in early October. That is not what we're seeing in Fairfax County. Fairfax County saw the peak in late May, early June, but then transmission levels have been relatively low and steady over the course of our entire summer, from July into October. I can't predict the future, but I can tell you right now, our case counts are on a slight decline, and hopefully we can hope that that will continue. Another threshold and data point that is used a lot in the media and that you've probably seen around is the percentage positive of individuals. This is just another strong epidemiological marker for us to detect whether activity is going up or down in our community. You can see that in Virginia over the last couple months, it's been steady with a recent decline, and the same trend has been seen in Fairfax. So we're seeing in Fairfax that we're testing on average of about 1,500 individuals every day for COVID-19, and about 2.5% of those are being seen as positive lately. That number is lower than what we saw. We're seeing a lower percentage positive than the rest of the Commonwealth of Virginia, which is a good thing. Now, Fairfax County, obviously, you may be asking, well, I have students from all over the region in Northern Virginia. Our numbers are very similar in the percentage positive and the case counts throughout the rest of Northern Virginia. How is COVID-19 spread? We're learning more and more about this disease. So COVID-19 is a respiratory viral illness. It's not, when they say the term novel, that means it's a new strain of disease. We've had coronaviruses circulating throughout our community in the past. This is a new strain of coronavirus. And the primary method of spreading all respiratory viral agents is through what we call droplet transmission. It's large respiratory droplets are produced by our bodies when we sneeze, cough, sing, talk, or breathe. The droplet itself is limited in distance. It only travels about 6 feet away from a person, or less than 6 feet away from a person, and falls out of the air rather quickly. Recent studies have suggested that droplets may be suspended in the air more, and I believe the CDC will be researching that and provide us more information. But right now, our current thought process is droplets are the primary method of spread, so you need to be within a close distance to an individual for a prolonged period of time when you'd be at risk for transmission. Another method of transmission, obviously, you could think of if you sneezed on a table and then someone came along and touched that table, touched their eyes, nose, or mouth. That's what we call contact with secretions. Touching any contaminated surface is a way of transmitting the disease. It's not the most effective method of transmitting the disease because one, the virus doesn't live long on surfaces. And number two, that's why we have our strong cleaning protocols in place to make sure that we clean high touch areas and we're washing our hands frequently. So it's not the most efficient method of transmission, but of course it is a method of transmission that we are concerned about.
What do you think about singing or wearing masks?
So we will talk about high risk activities soon. So we'll push off that question later. The question was about high risk activities in schools like singing. We're going to talk about that in a little bit.
What about open windows?
Yeah. Yeah, we'll talk about those control measures in a little bit. Sorry, I'll push those questions off just because we have slides specifically addressing those issues. Okay. The symptoms of COVID-19 are, I'm sure you've all seen these symptoms before listed in the news. The bad thing about COVID-19 is I'm sure you've seen these symptoms for lots of other illnesses that you generally see in the school setting. The symptoms of, the more common symptoms of fever, cough, sore throat, headache, congestion, runny nose, and muscle aches are very, very similar type symptoms to what you see for all of the respiratory viral things that transmit over the course of winter months and in our school setting. The less common symptoms that take place, loss of taste or smell, shortness of breath, nausea or vomiting, diarrhea, tiredness, and poor appetite. Again, those are less common symptoms, but we do see those symptoms, and especially we see those symptoms in children. So symptoms, children I'll jump into this, have been known to be less symptomatic than adults, which is a good thing, but they have kind of the wide range of symptoms. So we need to be concerned about all of these symptoms in our school settings. So that leads perfectly into the question of what should schools be doing in regards to exclusion for students and staff members who are ill. So the current recommendation from the Virginia Department of Health, which was just recently updated, and at the bottom of this slide, you can see a long link for an algorithm for this recommendation. But the recommendation is that given our current transmission levels in Fairfax County, any one of those symptoms that are listed, if an individual had a new onset of those symptoms, or it wasn't part of a chronic condition of that student. So if a student always has a cough due to respiratory problems, we wouldn't consider that. But of course, if any of these symptoms are new onsets, we would recommend that the student or staff member is sent home and sent to the doctor for evaluation. That would include testing. Testing would be recommended. The other part of this recommendation is that students and staff members would need to provide a health care provider note with an alternative diagnosis or a negative COVID-19 result before returning to school. This is obviously very different than what is usually happening in schools. This recommendation was given across Fairfax County to daycares as well as in our public school system, and they are trying to implement it as well. We understand the pressures that go into this and the concerns from parents who say, my kid just has a runny nose. Why are they being sent home? Why do I need to go to a doctor for that? And the answer, to be frank, is because we are in unprecedented times. We need to do our best to ensure that COVID-19 is not being spread in the school communities. If a parent refuses or does not want to bring their student to the doctor for evaluation, then we would treat that individual like a positive COVID-19 case, and we would have them stay out for at least 10 days. They'd be excluded from school for 10 days. The turnaround on lab results is much quicker than it was. Usually people can get a result within a day or two. So they would be excluded only until they have that negative COVID result. Obviously, if they are positive, if it's a positive result, they'd be excluded because they'd be working with the health department and they'd be isolated and told to stay at home and away from others.
To be clear, you're requiring that doctors not be given to come back to school?
Yeah, so the question is, do we require that a doctor's note is given before the student is allowed to return to school? We are the health department. We are strongly recommending that all students who exhibit any of those symptoms that are new are excluded from school.
Hi, I already placed a mobile order for a meat.
Sorry, we have someone who's not on mute. I'm just going to jump into participants right now and mute everyone. Perfect. Okay, sorry about that. So as I was saying, we strongly recommend, the health department strongly recommends that individuals who are symptomatic go home, see their doctor, and the doctor provide a note, or the individual is tested for COVID-19 and returned to school. It is up to the schools themselves to enforce this policy, to accept this policy. It is strongly recommended by the health department that this policy is enacted, though. The doctor's note, the Department of Labor's recommendations are for returning to work for asymptomatic individuals. That is not for symptomatic individuals. So we're considering two different things there. So that recommendation is similar to what that question is referring to, is having all students, whether they're symptomatic or not, be tested before returning to school, or all staff members provide a negative result, no matter what, if they're symptomatic or not. This is a specific circumstance where the individual is symptomatic. Therefore, public health measures are being recommended to ensure the person does not have COVID-19.
Okay, so I'm going to ask a question because I used the chat before and I didn't get my question answered. If we have a preschool located with our school, so we get a lot of runny noses with the younger ones, and it is allergy season. So you're recommending, because of the COVID, to go ahead and send them home and get the doctor to say it's allergies and get a doctor's note and for return to school.
So the recommendation is if this is new or unusual for that student. So if the student has, it is known to you that the student has allergies or a pre-existing condition that would give them those symptoms, then they do not need to go to their doctor. Now, if it's a new symptom, it's a symptom that you've never seen in a student, I would stand on the side of caution and send that student home. This might be the good time to evaluate with your student body. What are any existing conditions for your students? Update those health records on students so kind of those conditions that would exclude them from this recommendation.
Okay, can I go back to a previous question?
Yes.
You were talking about the droplets, and I understand it's a droplet disease, but then you were talking about touching a surface and then touching your eyes. So you're not contaminated if the person is positive for COVID and actually touches it with their hand. They actually have to sneeze on that surface in order for that surface to be contaminated.
Yeah, yes. I mean, the good news is if we have a COVID-19 case, we hopefully are isolating that individual. But if the individual is in your school setting, we want to clean everywhere where that individual is, given that they could have sneezed on their hand and then touched the surface. We're not worried about, we're really worried about high touch areas because that's obviously areas where individuals would touch more of. Of course, a person a case can contaminate an area given that their respiratory droplets are probably very much all over that area that they've been sitting in.
Okay, thank you.
No problem.
And just for clarification, this new recommendation, how old and when was this made?
So this recommendation actually has been around all summer. They recently updated the figure to clarify it. It was posted, I don't know, it was posted on their website sometime, I believe, in August, but the new updated algorithm, which is a little bit clearer and easier to understand, was posted about 2 weeks ago. Oh, Friday. It was posted Friday. I'm being corrected by someone in the room. It was just posted on Friday. Okay, great. Great questions. Thank you. Keep them up.
Valid as a regular test?
Yes, the rapid test is a positive rapid result is very, very reliable. A negative rapid result, we're telling healthcare providers to, if the person is symptomatic, to confirm with the better PCR test.
And when you say a long period of time, what do you mean? You're in a room with somebody for a long period of time.
Yeah, the exposure definition, so prolonged period of time, is greater than 15 minutes within 6 feet. That is our contact definition. So it's greater than 15 minutes.
So should we allow a student with a negative rapid test to come back to school or make them get another test?
A student with a negative rapid result, what we're recommending a healthcare provider do is test if they are symptomatic and the doctor believes that it is a positive COVID case. We're telling the healthcare provider to test with a negative with a PCR. If the doctor believes it's COVID-19 still, and they're doing that test, the student should be excluded until they have the negative PCR result. So it really has to do with the doctor's note that's allowing the student to come back to school. It's what the doctor believes the student has.
Is it 15 minutes cumulative or consecutive?
The definition for a contact is cumulative. It's not consecutive. So 15 minutes is the cumulative definition.
And before, if I was under the standing, we couldn't force them to get a COVID test, but now we're not necessarily forcing them to get the COVID test. We're sending them to the doctor and the doctor's deciding whether they get the COVID test or not.
Yes, but it is within your purview as a school to state that a student cannot return without a COVID result or a diagnosis. Or the student is excluded for 10 days.
And
is-
that we do have that option now?
Yep. Oh, you always had that option. It was your school policy it's your school health policy to enforce whatever you feel is appropriate. It was just like a student. If a student was febrile, you had the ability to ensure that student went home. It's the same principles.
And
Could you, go
sorry,
ahead.
from what I understand though, if it's an exposure, it has to be 14 days, but if it's a positive COVID test, then it's 10 days.
Correct. Yeah, and we'll jump into that in 2 slides.
And just explain, if you could, just quickly, the cumulative. I have been under the impression it's 15 minutes, consecutive. So, if someone is exposed for 2 minutes and then 2 minutes again and 2 minutes again, what does that mean, cumulative?
Cumulative means exactly that. So if I'm a teacher and I spend 5 minutes with student A and then keep on going back to that student during the daytime for 5 minutes, then the cumulative amount of time is what we consider, not the 5 minutes of one-time exposure. We would add up all the minutes of exposure, and if it's greater than 15 minutes within 6 feet, then we consider that a contact to a case.
Okay.
And that would be across the person's infectious period while they're infectious. It's over the course of while someone was infectious. So it could be 3 days, over 4 days, it could be anything.
There's a school who is.
I'm sorry, and does that also include if the people were all wearing masks, it would still be considered a contact?
Correct. Yes. Unfortunately, masks are great. They are very, very effective, but they are not, as we all know, they are not perfect. We do not consider mask wearing. We only consider mask wearing protective in the healthcare setting. We do not consider mask wearing protective in school or community settings, given we don't know how well someone is wearing that mask, and it's not, cloth face coverings are not the perfect solution for protecting against respiratory droplets. So whether or not students or staff members are wearing a mask, that is not considered when we're deciding if someone is a contact to a case or not.
So the school is quarantining people for 14 days after they travel by flight or train. Families are pushing back on this and asking to test out of quarantine after 7 days. What would you advise?
So right now, the question that was posed in the chat was about travel, and if students should be restricted after they travel, or staff members should be restricted after they travel to a certain area. In Virginia, that is not being recommended. We do not have travel quarantines or travel advisories for any area. Transmission levels vary by location a lot. We do not know the risk level in any of those areas. That is why we do not recommend any public health measures for students who are traveling. It's for the school to make their own decisions on what they decide. I would say, though, that testing out or testing a negative would not be the best method. If you did decide to do some sort of travel advisory, travel policy for your students or staff members, testing out after 7 days would not be an effective methodology to ensure that the person is not infectious.
It needs a little bit of this clarification. It's very difficult to make and communicate school policies when our goalpost not only changes but differs between health authorities. Should we be following Fairfax County guidelines instead of the CDC? And it's because in the CDC return to school, they have it split into section 1 and section 2. And so for if yes in section 1, and yes, and any component section 2 without negative test results, can they be permitted to return to school? And a negative test or doctor's note should not be required for return. And that is this person's contention, is that why are we requiring a note when CDC says do not?
So the Centers for Disease Control writes recommendations for the entire country. It is up to the state health departments to decide how they want to proceed with those recommendations. You should follow Virginia Department of Health and Fairfax County Health Department recommendations. We obviously take everything that the CDC develops into strong consideration. We implement it as closely as possible, but we are the local health authority and we are the ones who are responsible for giving recommendations in this area. I believe I already answered the travel question. We do not recommend that. That is a policy for your school. You can put that policy in place, but that is a policy that you would have no public health recommendation behind it. Yep. Okay. So we should keep moving. The daily symptom screenings in schools, this was a question at first. Virginia Department of Health here does agree with the Centers for Disease Control on that recommendation. We do not recommend universal symptom screenings to be conducted by schools themselves. Obviously, schools can do that if they wish to. What we mean by that is, are you asking your students and staff members every day to take a look at symptoms, and you're asking every day and doing temperature checks on students? A lot of schools are doing that. We're not recommending that you stop that by any means, but we definitely, at the very least, would encourage schools to strongly encourage families, faculty, and staff to monitor their for the signs and symptoms of illness every day and stay home when they are ill. The recommended wait time after exposure for being tested is 5 to 7 days after exposure. So, some terms that you guys should be familiar with, and some timelines that we just wanted to lay out in a nice table for you. So, if a staff member tests positive for COVID-19, the recommendation is that they are isolated for 10 days and they are at least fever-free with improved symptoms for at least 24 hours. So if someone is very sick with COVID-19 and is staying ill, that isolation can obviously be longer. In that scenario, I'm guessing that they probably wouldn't be wanting to return to school, but just for your baseline and for your knowledge, the baseline amount of days for a student to stay out if they're a positive COVID is 10 days. They'd be out for 10 days. If they test negative or they have another diagnosis from a provider, you would fall back on whatever your existing practice is right now. So I know a lot of schools recommend that students stay out for 24 hours for fever-free. So if that's your policy, that would be your policy for that circumstance. If the student left school febrile, but they were negative or they had no other they had an other diagnosis for their illness. If an individual is not tested or not evaluated by their healthcare provider, like I said previously, you would treat them like a case and they'd be out for 10 days. And anyone who is close contact to a case, this is where we'd recommend quarantine for that individual. They'd be out for 14 days from the last contact with that case. The health department's role is to determine who is a contact to a case. The schools do not need to do that. They don't need to worry about it. It is the health department's role to identify contacts and make sure they understand what the quarantine recommendations are for that individual.
Can I ask another question?
Yes.
We actually have a positive contact in our school right now, and they're saying that the siblings and the positive person can come back at the same time. Shouldn't the siblings be longer since they're exposed, not positive?
I don't know the specifics. You'll probably have to you can reach out to us and we'll actually talk about the specifics. Generally speaking, yes. I mean, your quarantine period is longer than your isolation period. So you're absolutely correct. So if you look at this, you're isolated for 10 days if you're case, you're quarantined for 14 days if you're a contact. That has to do with you're isolated we isolate you for how long we think you are going to be infectious for. You're quarantined based on the incubation period of the disease, which is how long it takes for you to develop symptoms of the disease. So you can develop symptoms up to 14 days after being exposed. So that's why quarantine is longer than isolation. But you're right, it should be different. It shouldn't be the same, but I'd have to look at the specific details of that to figure out why.
Right, I understand that, but it's something to definitely ask.
Correct. Yep, exactly.
And just one more question about the exposure. Some of the states are requiring that if you are a close contact with someone who has gone to get a COVID test, hasn't gotten the results, that you have to quarantine. Is that a recommendation of Virginia Department of Health, or is it only after you get the confirmed case?
Generally speaking, it's only after the confirmed results. Now, there's a lot of caveats there. If you had someone who the doctor feels is very much a COVID case, we may recommend very close contacts, household members, to stay home and away from others. Unfortunately, the school's not going to really know that a lot of times, what the doctor feels. For the most part, though, we would not be doing anything with contacts to someone unless they were a confirmed case. I know that doesn't help you guys much at all in dealing with siblings, but that's really where we stand right now. We don't want to put these very restrictive measures in place unless we confirm that COVID-19 diagnosis.
But as a school, we can make that decision on our own, even though it's not recommended by you, correct?
Absolutely. Yep, you could.
Let's go on here and it says speaker.
Oh.
Oh, see, now it's still going.
Okay.
Why did it not?
So is someone trying to ask a question right now? No, I'm going to mute all again just to make sure, because I heard some background noise there. Perfect. So if you just need to ask a question, you just need to unmute. Okay. What do you do if you're notified of a case amongst a student or staff member at my school is our next question. We actually in Fairfax County created a reporting link for you all. This is a methodology. We wanted to make this as simple as possible for you and as efficient for you to report information directly to us so we can start our contact investigations as soon as possible. A lot of concerns on your guys' end, the school's end, is how quickly will these investigations be done? I can tell you right now that over 95% of our case investigations are started within 24 hours of us being notified. We identify contacts very quickly. We have a large team here that is working very, very diligently to identify contacts as much as possible, because that's our purview. We need to identify those contacts as soon as possible so we can isolate and quarantine individuals quickly. So this is a reporting link. It's a secure link that you guys can report into. It's the same link every time. We're going to be asking you for information on the student or staff member that you'll be reporting to us. Who should be reported in this portal? This portal is only for confirmed cases, so a lab result or a physician diagnosed case of COVID-19. It is not for students who are 100% virtual with no exposures in school that we need to, we're really only concerned about students who have exposures in school. We also do not want to receive reports of individuals who are just symptomatic and sent to the doctor. We want the report once they come back from the doctor because we want to act on actual cases. And then the other thing that we don't want in this report are contacts. We don't want contacts in this report. We're aware of the contacts because we're doing those investigations. But this is hopefully a very efficient and easy way for you to communicate with us on a case.
What if it's somebody who doesn't live in Fairfax?
You can still report cases to us, and we will make sure we transfer those cases as soon as possible to the correct jurisdiction where the individual lives. We'll be your funnel for that piece. The question was if the student does not live in Fairfax County. I'm sorry. Okay. So I've alluded to a lot of this already, but what do we do when we find out about a case? As I said, our priority is the case investigation and the contact investigation. So our case investigation includes calling the patient as well as calling or the parents of that patient and the doctor to confirm that that individual is a COVID-19 case. We collect some information on the individual and then we give them isolation guidance, what they need to do. They need to stay at home and away from others. We follow them to make sure that they're following that process. The next piece of our contact case investigation is our contact tracing. That's where we talk with the case. We may talk with the school to try to identify individuals who are a contact to that case. Those individuals, once we identify those individuals, are told to quarantine for 14 days from the last date of exposure. So again, we put them under a monitoring program that follows up with them, that ensures that they are following the quarantine that we have prescribed to them. If we have more than one case at a school, That's where a specialized team at the health department will become involved. They will work with the school to ensure that the school understands all of the public health guidance that we have provided to the school. This is where we would really review cleaning guidance. We would talk about different class settings and different activities that are done at the school. Based on the investigation, some of our interventions are very, very standard. Others may be less standard and something that you guys haven't considered. If we had so many cases, that's where we consider the recommendation for closure of a classroom or a school. It really depends on the situation and the numbers and the measures that have been put in place by the school itself based on that. But we do have specialized teams that have been working with many, many facilities over the course of this pandemic. We have a team singularly devoted to school outbreaks here. It's a team of 4 individuals that their whole world and their work is just looking at daycares and school outbreaks. Another essential tool that you all are aware of is notifications. This is essential from both your perspective to keep open lines of communication with your school community, as well as providing very, very important public health guidance to your school community. So we utilize school notifications for anytime a case is in a school. We have template letters available to you to utilize, and we can share those with you. But we will be able to also provide you guidance on when we think you should be sending those notifications and who they should be sent to, whether it be the entire student body versus just one classroom. But we have template letters available to you. You can reach out to us, and we will share those letters with you, no problem. We had this question already, but one of our box it in strategies that we in public health recommend is the testing of contacts to a confirmed case of disease. This testing is not to clear the person so that they can go back into public. Unfortunately, this individual who's a contact still needs to be quarantined for 14 days. The purpose of this testing is so that public health can identify someone who is likely to become a COVID-19 case as quickly as possible. As I stated, this testing is recommended for all contacts 5 to 7 days after their last exposure. If you have any students or staff members who are unable or don't have a healthcare provider to get testing done at, the health department has testing sites across our community that are available at no charge for individuals who are a contact to a case. That information is available on our website, so you can refer students and staff members to that if they're having trouble getting tested. Our turnaround time for our testing is 1 day. So it's a very short turnaround. So they will have results very, very quickly.
So the close contact of the PUI does not need to stay home until the results come back on that PUI?
Correct. Yeah. So the question was centered around a person under investigation. If the contact to that individual needs to stay home and away from others, our recommendation for that individual is to monitor themselves for signs and symptoms. They do not need to stay home. I've thrown a lot of terms at you guys. This is a review of those terms to make sure that everyone's on the same wavelength in regards to kind of the terminology we're throwing around in regards to COVID-19 and public health guidance. A case, again, is an individual who has been diagnosed with COVID-19, either through a lab result or a physician diagnosis. We isolate cases. We tell them to stay at home and away from others. They are a case. A contact is an individual who meets our contact definition, which is within 6 feet for greater than 15 minutes while the person was infectious. We quarantine those individuals for 14 days from the last day of exposure. The one that always trips up everyone is contacts to a contact. This is the scenario where you have a staff member call into your office and ask you, my husband was at work with someone who had COVID-19 and he has to stay home. What do I do? The question for that individual is that individual just needs to observe themselves for signs and symptoms. They do not need to be quarantined. So if you have a close contact who is quarantined, That does not mean that you need to be quarantined. You are quarantined only when the health department tells you you are quarantined. That is very, very tricky. It's thrown up a lot of issues and concerns from people. I hope that's clearer now. Effective approaches to preventing transmission. Sorry, the pause. I was seeing if there's any chats in there. Wearing a face covering. We've talked about this. Practicing social distancing is key in your schools as much as possible. You want to really enforce and enhance hand washing activities throughout your school. Routine hand washing breaks are recommended. We want to make sure we wash our hands as much as possible. We want good coaches on hand washing as well. So if your school nurse or your teachers can really show the younger students in your schools how you should hand wash, that would be the best methodology. And then obviously, very, very big, and we've been talking about this a lot, individuals who are sick need to stay home and away from the school. A lot of questions have come up surrounding the effectiveness of cloth face coverings. Although I said it would not preclude us from a contact investigation, it is truly effective, and we should be trying to push for cloth face coverings in every public space and as much in the school as possible. So here's just a little case study by the CDC where they had 2 known hairstylists with COVID-19. They spent really close contact with a lot of clients, 139 clients. Not one case was known to be affected because everyone wore face coverings. So it very much is effective and instrumental in the slowing the spread of COVID-19. Some things that I pushed before when you guys asked questions on, and I wanted to really emphasize, and I know a lot of schools are taking these approaches right now. The best methods of trying to stop the spread of disease within our schools right now, one of them is to reduce the number of children and adults who are in contact with each other. This is where your pods come into play. So if you could have students, less commingling of students as much as possible, and I know all of you are trying to do this. I know it's very, very difficult, but this is making sure classrooms are eating lunch together rather than with other classes. The sharing of classrooms and the splitting up of students into different classrooms with other students from other classrooms is not recommended at this time. And I know this has been a very much a logistical challenge for schools, but reducing that number of shared classrooms as much as possible is instrumental in stopping the spread of disease within your schools. You want to also increase your ventilation as much as possible. So while it is still warm, we want to open our windows. We want to utilize outdoor times as much as possible. And we do want someone from your facilities team to take a look at your air exchanges and your filters to make sure they're adequate for your school setting. I am by no means an expert on that, but I know there are individuals who are experts on that on your facility side of your school that will be able to give you recommendations on, are we getting enough air exchange, and is our filters changed as well. You want to routinely clean and disinfect high touch surfaces within your facilities. Carpools amongst staff and students should be avoided if at all possible, because that is a very closed, confined space where the disease can be spread. And you want to try to restrict visitors as much as possible within your schools. I know some schools have gone as far as not allowing parents in the school. It's almost the students are valeted to the schools in the morning when they're dropped off by parents. We want to limit visitation into your school as much as possible, because that's just another avenue where the disease could be introduced into your school setting. Another thing that we've really been trying to push for, we know all of you are really pushing for really strong public health measures in your school setting. It doesn't do us a lot of good, though, if people do not follow those same measures at home. So really try to push with your staff and your communities that those measures should be followed at home as much as possible as well. People are home more time than they are at school, so we want to make sure that individuals are staying safe and healthy at home as well. Some activities in regards to COVID-19 are more risky than others. We don't really have specific guidance on how to approach those things. We're just trying to raise your awareness on those type of activities. So, and what I mean by we don't have specific guidance, we always want to try to enforce the things that we know stop the spread of disease. Social distancing, wearing face coverings, hand washing. Those things will help in any of those higher risk situations. So the bus, obviously, transit to and from school is risky just in that it's a closed, confined environment. We want to try to enforce social distancing as much as possible and wear face coverings on buses as much as possible. Anytime you're eating, just the nature of eating causes respiratory droplets to kind of spread. That's a high risk activity. We found many outbreaks in our community, not just in schools, associated with staff break rooms. It's a struggle for us right now. Individuals are doing a great job all day long, and then they go have lunch with their friends or sit in a small break room with their friends and they're eating lunch without a mask on. It's something that we strongly discourage because we've had numerous outbreaks stem just from break rooms and staff members eating lunch with each other. Anytime you're physically active and playing in a gym, it's just going to cause you to breathe heavier, causing more respiratory droplets. And then obviously another one that was mentioned before, choir and singing. While we don't recommend that those activities stop, we want there to be as much social distancing as possible for those activities to ensure we're trying to limit the spread of disease. Some things that you should consider, yes.
One of the questions is about not having mixed groups in the lunchroom, even if they have 6 feet of distance.
So if you're socially distanced, that is adequate. So that would work for you guys. You want to make sure okay, so the question had to do with cafeterias. Can we allow larger groups in the cafeteria of mixed classrooms in a cafeteria if we're still doing social distancing? I would say that the recommendation from the health department is social distancing is key in that scenario. It's still not the best, but it would be, as long as we're meeting our social distancing and we're cleaning afterwards, it would be an adequate response.
Is it appropriate for children to sing indoors with masks? Does that make a difference?
I would recommend that the students are, I would still recommend that the students are socially distanced when they're doing that singing. Mask is great. It might be hard to sing with a mask on, but I would definitely recommend mask and social distancing. They can sing indoors, that's fine. Yeah, you might want to expand the area. It might be one of our school health leadership individuals in the room just stated that 10 feet is the appropriate measure for that.
And just one more question along the lines with some of these cafeteria, these questions. If you have a pod and they're already kind of in classrooms less than 6 feet, and then you're going to the cafeteria, is the pod is it okay for the pod to be sitting more closely, and then with the distance between the pods, just trying to kind of visualize?
Yeah, of course. So I think where eating becomes riskier is because individuals are chewing, their mouths are open, there's more respiratory droplets, and there is no mask wearing during lunches, right? So I would strongly encourage social distancing during lunch periods. Yeah, and pods are so we don't have cross fertilization of disease within your entire school. And I know it's, again, I'm being repetitive. I know it's a struggle in the school setting logistically. It's been a huge headache for you all, but it's so that if we do have disease within your schools, it doesn't spread. It's limiting the spread to maybe one pod rather than your entire school. That is the key instrument here. We want to limit cross-pollination as much as possible within your school.
Do we have any statistics on the percentage of children in schools who are potentially asymptomatic, and which would require us to, use good mitigation strategies to keep them apart? But what is that percentage? Do we have it?
I don't have the percentage of asymptomatic individuals. I can tell you that students, specifically younger children, are much more less severe symptoms or asymptomatically infected. So children just tend to get this disease a whole lot. They're doing a whole lot better with this disease than adults. And they also spread the disease a whole lot less. So it just speaks to, your point is very well taken. if a large proportion of our students are asymptomatic, these mitigation measures are crucial because you won't be able to identify cases in your schools. I don't have the percentage, I'm sorry. The question, I believe, is about the question that is on the chat box is about a large gym, whether again, anytime students aren't wearing masks, or really anytime students are together, we want to try to enforce social distancing as much as possible. The space doesn't matter. Social distancing is crucial for any sort of control measure and to stop the spread of disease.
And just one more question about the social distancing. This is so helpful, but when they're playing outside, our students have been going out for recess, but not really wearing masks. They kind of take them off and run around and play, bump into each other, keep playing. Is that a problem? Or is that less of a risk?
Yeah, and so all I can tell you is our recommendations. Unfortunately, okay. I know how tough that situation is. Students are going to play in school, but I can also tell you the ramifications of it as well. So we're going to recommend that cloth face coverings are worn at all times. We want to recommend and try to enforce that social distancing as much as possible. Kids are going to play on recess. I fully understand that, but recess, we've already had scenarios where we've had a case of a COVID-19 in a class, and recess was kind of the point where the entire class was considered exposed because they were all running around together. So an entire class needed to be quarantined. So that is the ramifications of not being able to do that, that social distancing during recess. We understand you guys have an extremely difficult task right now of trying to maintain a very, very strong educational and kind of social atmosphere within your school while also putting these very, very hard measures in place. So we understand the struggle. Unfortunately, all I can tell you are the recommendations.
What is the percentage though of if they're running around with a mask on, isn't there a risk of retaining their own CO2 and passing out?
The risk would be, I'm looking at some health professionals in this room. The risk would be extremely to non-existent of that. Yeah. Yep. Yeah. And again, before recess, after recess, enforcing hand hygiene is another thing we want to strongly recommend. The only individuals who are not recommended for cloth face coverings are anyone under the age of 2 because of the choking hazard due to the mask in front of them. I've talked a little bit about this already, but you know, this is a lot of unknown science here. As I said in the beginning of the presentation, COVID-19 is a brand new disease. A lot of our knowledge on COVID-19 is based on our knowledge of coronavirus, which is, it's a type of coronavirus. What we have found so far is children are much more likely to be asymptomatically infected than others, which is good from a health outcome perspective, obviously, right? Children are less sick than adults. That's great news. The bad news in a school setting is you might have COVID-19 cases in your school and you don't know about them. Also, it appears that children between the ages of 0 and 9 are less likely to spread infection than other age groups. That's kind of common sense though, right? Because children just lower lung capacity, they're less symptomatic, so their coughs aren't as strong. They don't have a cough, so they're not spreading the disease as much as possible. So there is some logic there, obviously, as well. And then we've also found that in households, younger children appear unlikely to introduce infection or to be infected if another family member has COVID-19. So we're not really seeing a lot of spread to younger children within the household setting, which would suggest that spreading in school would be even more difficult. So hopefully we won't have many secondary cases of disease in any of our schools.
Specific types of masks that are recommended or some that are not recommended?
Right now, public health is just generally recommending cloth face coverings. You know, some are more effective than other. Always, you know, loop around the ear or loop around the back of the head. If you're asking about the gaiters and all those other types of masks, I'm not exactly certain on them. They have shown to be less effective. So that's why we're saying cloth face coverings with loops around them are the best approach right now.
And is the recommendation masks at all times except when eating or drinking plus 6 feet, or they can take them off when they're more than 6 feet apart from each other?
We would always recommend as much mask wearing as possible. Of course, you can allow breaks and all that kind of stuff from mask wearing, but we want to have masks on as much as possible in our school settings. We are recommending that people wear masks. Yeah, so the question keeps coming back, when should students have masks? We cannot set your policy. All we can recommend is that people wear masks as much as possible in the school setting. Obviously, the one time we would never recommend it is while eating. Eating, we would not recommend mask wearing. So I'm sure about, oh geez, this is now about 2 months ago, you saw news reports of massive outbreaks in our school settings. So this is on the no socially distanced hallways and pictures of the hallways. And I will tell you right now, we've had reports of outbreaks in schools, in private schools in Fairfax County. By no means are the numbers as high as any of these outbreaks that we've seen across the country. So outbreaks have occurred in school settings. On the other hand, in Europe, very, very small number of cases of outbreaks. So it's hard to tell right now. The data is very, very fresh. Some of you just opened up a few weeks ago. Some of you have been open up for a few months. I think it really, really varies. And obviously, one of the other huge factors to this is how much transmission there actually is in the community itself, where the school is located. Right now, our transmission levels, I'd categorize them as medium low. We don't have as many cases as seen across the rest of the Commonwealth. That's not to say we're at no risk at all. So I think, outbreaks follow where transmission occurs. So if we started seeing a spike in cases here, I'm sure we'd also see a spike in cases in our school settings. So that's why it's very, very, it's key for you to kind of keep your awareness of what the activity levels are within our communities. One thing that we have seen as a common denominator a lot of times, and I'm sure some of you are aware of this, where the case is coming into the school is not the student for the most part, it's staff members. As we said before, students are less infectious, less symptomatic than adults. A lot of times what we're seeing is the staff members are bringing the cases of disease into the school community, which speaks to, I know you all are thinking about through your student policy, your student health policy, you need to have just as strong of a policy for your staff members as well. They need to evaluate themselves for signs and symptoms and be able to call in to your school system sick, and they need to know what to do when they do call in sick with any of the symptoms of COVID-19. Risk is less in the lower graded students than the older students. That kind of just coincides with what I was saying about infection is less severe. We haven't seen many secondary cases, which are good, but we have had a handful of outbreaks. Outbreaks for us are considered 2 cases of disease in clustered in space and time. So 2 cases in a classroom, 2 cases in a bus, that would be considered an outbreak from a public health perspective. Transmission seems to be much more common from staff to staff than child to staff. And there's still just a lot we don't know. Some other kind of points that we wanted to make sure that you understood from kind of our experience so far working with private schools. We always recommend when we have an outbreak that we perform a site visit at your school. That is not a regulatory visit at all. That is a means for us to be able to show our face to you, work with you, be able to talk through questions with you. We want to see if we can improve any practices. And to be honest, schools have found that very, very useful in that we're giving recommendations and you can share with your community that you're working with the health department on the situation that's happening within your school. The other point that we really need to hark on is, although COVID-19 is extremely serious, we also have to take the confidentiality of the patient just as seriously. We want to limit who knows about a case as much as possible within your school. Administrative staff should not be sharing widely if a student or staff member is positive with COVID-19. That's not to say we shouldn't be notifying individuals there's a case, but the name of that individual needs to be preserved. That is medical, it's confidential information. It's their health information. We cannot share that information with anyone else who needs to know. Children definitely model the behavior of this, as you are, you're in education. They model the behavior of adults. So if your staff members wear masks improperly or are not wearing masks in the classroom and you think that they should be wearing masks, that is going to be modeled by the students as well. Hand washing should be done by your staff members as a model to your students that hand washing should be done routinely. I would say this is hopefully a great presentation to also share with the teachers within your school. Teachers are very, very receptive to doing things that they understand. And I hope that we've expressed in this presentation why these recommendations are in place, the importance of these recommendations. Please share these slides with them or share this information with your staff members at your school so they understand the approaches that we're taking from a public health perspective. We've also noted that staff who have a checklist have generally the cleanest and most compliant spaces. So if you have a teacher and you're asking them to wipe down the classroom with Clorox wipes, if they have a checklist for that, that generally is the best methodology, the organized mind kind of approach. And then recess with no modifications is a chance for significant amount of exposures. We already talked about that. Recess is a great opportunity for transmission of a disease. So try to modify that as much as possible to limit transmission.
Can you clarify the second bullet point? The question is transparency is only regarding specific patient information, not fact that cases are in school.
Exactly, yes. So the question had to do with the confidentiality bullet. We absolutely want to share information with your community that there has been a COVID case in your school and there has been exposure. The thing we cannot share and we will not share is the name of the individual. That's something that you guys, you're aware of that. We can't say John Smith is, the case is in this classroom and his name is John Smith. We cannot divulge information on who is the COVID case. We need to share that and then of course your administrative staff will know about that case. We want that to be known by as little number of people as possible. So I know we've given you guys a lot of information. What can you do right now other than reviewing this information, understanding it, asking questions to us? Anytime you find out about a case, please report it to us so we can act on it as quickly as possible. It's helpful to you as well to know that we're going to work up that case as quickly as possible. We're going to identify contacts in the classroom as quickly as possible so that individuals who should not be in school are removed from school. That is crucial from our perspective and your perspective to stopping the spread of disease within your school. When we call you back and we're talking to you about trying to identify who's a close contact to a case, please work with us. Help us identify who would be a close contact in that setting. You also, if you know students or staff members are under isolation and quarantine and they show up to school, please, they should not be in school during that time. Make sure that they are out of school for their appropriate quarantine and isolation period. And then last, if you have any questions whatsoever, please do not be shy. Call us. We are here to answer your questions to help you through this pandemic. Call us. You can also email us at hdcd@fairfaxcounty.gov. If it's a less severe type question, if it's just a question you want an answer to, please email us questions and we'll get back to you as soon as possible. We'll put that email address in the chat right now as well.
I have a question for you. We
Yes.
use the health check app every morning. We're lucky enough to have that at our school. And we have some faculty members that say that they have symptoms. Do I have the right, or do we have the right to send those if I feel the symptoms are, I'm the school nurse. But between me and the principal, do we have the right to send that faculty member home? And do we have the right? And do we have the right to ask for a COVID test?
Absolutely. So you do not have the right. It's the staff member's choice how they want to proceed. So you have the right you can set your employee policy to whatever you want it to be. We would recommend that the employee policy, if anyone develops symptoms of COVID-19, that staff member is told to go home and that they need to be evaluated by their healthcare provider. the return to, if they do not want to be evaluated by their healthcare provider, you have every right to say, well, then you will need to stay home for 10 days for your isolation period. That is what we are recommending the policy be. Now, a lot of times they will not want to stay home for 10 days. So what they can do is go to their doctor, get an alternative diagnosis, or a negative lab result would prove that they don't have COVID for us. And then they can return to work.
Okay, so it's the same as the student, so we can
Same.
provide the
Yep.
same measures to the staff as the students.
Yep. And it's our recommendation, strong recommendation, that you try to enforce that policy as much as possible. It is up to you to actually make that your policy, though, in your school setting. You have a lot of backup to that, though, given that it is a recommendation on the Virginia Department of Health's webpage.
Thank you.
No problem at all. So one thing I did want to touch on briefly that is an evolving situation. I'm sure you're all aware, there has been requests by lots of different people to share school level data in regards to on public facing websites about who has cases and who does not have cases. The Fairfax County Health Department does not share any data that we're not allowed to share. All of our data sharing policies are governed by the Virginia Department of Health. So the data that you find on our website is cleared by the Virginia Department of Health for being able to be shared. Their policy has to do with keeping patients confidential as much as possible. Right now, the Virginia Department of Health is currently considering the possibility of sharing school level outbreak data on its dashboard. If and when they make that decision, we will share that with you so you're aware. But this would be, they would share if a school had an outbreak. It would not say who has a case in that school, but that is the type of things they're considered sharing right now. We have no control over that whatsoever, but that would be shared on the Virginia Department of Health webpage. Just wanted to give you a heads up that they are considering that right now.
When a case is identified until the contact investigation can be completed.
So the question was, will you pause instruction learning while the contact investigation is done? That is, to be frank, that is a policy that we are working with the Fairfax County schools to implement. The theory would be that you have a case in a third grade classroom. You would notify the health department. The entire third grade classroom would be put on remote learning until the health department comes back and says a day later, 2 days later, we have identified all the contacts. You can have everyone come back to school who's not a contact. That is something that we're working with the Fairfax County Fairfax County school systems to implement. If you want to implement that policy, we fully endorse it and we will work with you on that. Our case investigations are fairly quick turnaround. Generally, within a day or two, we know everyone who's a contact.
Sir, if we received a phone call from a parent at 11 a.m. that their child went to the doctor, got a test, and they tested positive, and school lets out at 2:30, should we send them home at 11:30 or 12, or could we wait till the end of the day?
I think that's up to you. It's so tough there. I understand it's why push this. I would say you're fine letting them home at the end of the day. We're gonna work through it. But to be honest, you all know by the time all of the parents come to pick up their kids during that day, it might not be 2:30 anyway. Yeah. So I think it's up to you guys. If you wanted to put a very, very strong policy in place that everyone needs to go home right now, then you by all means can do that. I would not push that. We understand the logistical nightmare of getting all of the students home.
Thank you.
Yeah. So something that can speed in our investigation is if you have up-to-date class lists and seat charts in all of your classrooms. That way we can quickly review that information and identify very, very quickly who is a contact to a case. So we strongly urge you to do that as well.
We are concerned about students and staff returning from holiday travel. Would you recommend we pivot to distance learning from Thanksgiving to early January?
Again, the travel question comes up a lot because it was such a strong issue in the beginning of this pandemic. Right now, we have no recommendations for any sort of post-travel. Now, if you see a spike in cases in this area, a large increase in cases, you have every right to say, there's a lot of cases in Fairfax County in this area now. We're going to go to remote learning. We would not recommend, based on travel, any sort of special remote learning. Given that we don't know where people are going, we don't know the risk where they are. Risk is so variable for all of the travel questions. It's kind of a dark hole you go down where you're assessing an entire state based on one area. It's really, really difficult to ascertain. So so to answer your question, we would not recommend anything special for after holiday travel. Make sure your screen, if you're really concerned, make sure your screenings, those self-screenings are being done appropriately. Really push with your staff to look for students who are exhibiting signs and symptoms, identifying those kids as quickly as possible. I'm sure you all know where resources are for you, but we wanted to provide the links for resources for the Centers for Disease Control, the Virginia Department of Health, the Virginia Department of Education, and the Fairfax County Health Department. On the Fairfax County Health Department's webpage, you'll find all of our contact information. You'll also find our data dashboard with up-to-date data for Fairfax County itself. I do want to say, I hope it's come across, we fully respect the work that you are doing. We understand how extremely difficult this time has been for all of your schools. The health department, we hope we've emphasized, is a partner to you during this. We want to guide you and help you through this process as much as possible. We do not want to be the bad guy at all. We will be the bad guy for your parents when you're putting these measures in place. We want to be your partner to help you through this. We know we're going to have a couple with flu season starting. It's going to be a very extremely difficult next few months. And we just want you to know that we are here with you during that process. Yeah. So right now, the best number to call for any question, this is our call center that's available 7 days a week. They're here. So this is that number is the best input number. If you have just general school questions, you can email them to us. That's not for urgent things though. That email address is hdcd@fairfaxcounty.gov. That is also reviewed 7 days a week. Did you put it in the chat? Yeah, good. So we went through a lot of questions. You guys did a great job with questions. Okay, so I see the question on the most recent chat box. To be clear, the health department will decide about a class being kept at home after a positive case. So we will recommend actions being done. We're always going to try to recommend only those individuals who are considered a contact be quarantined. Only if an entire classroom is considered exposed will we recommend that the entire classroom is kept home. Unless we're starting to see more transmission within that classroom, that might suggest to us that transmission is widespread within that classroom. So we will be able to work with you on that recommendation. That's not to say, I know other private schools have made this statement. If we have a case in Mrs. Smith's third grade class, the entire class will be remote for 14 days. We are not discouraging you from doing that. If that makes it easier on you, you can absolutely do that. Yeah.
Read the question out loud, though.
They had a case on Monday, which was a holiday, and they're still in limbo about it. So have them just contact us and we'll follow up.
Yeah, we'll follow up with that individual case. We'll get that. Renee will reach out to you right now directly to make sure he gets your contact information through the chat right now.
That contact information that is provided is for holidays.
Yep. Yeah, that number that's provided. We have people working every day the call centers and our email addresses. So that's the best way. The other thing is, if you have a case and you report it into our online portal, that connects directly to our containment branch, which are the individuals doing case and contact investigations. Those individuals do investigations every day, 7 days a week, for about 12 hours a day. So they're here all day long, every day. Recommendations on specific cleaning supplies. I am not an environmental health specialist. We always just generally recommend bleach is a very effective tool in cleaning. But what I would do is I would point you to the cleaning guidance on the Centers for Disease Control webpage. They will give you the best products for cleaning. Coronavirus is not the hardiest of viruses, but they will tell you exactly what agent is effective in killing it. I'm going to wait for another minute or so to make sure no one has any other questions. That's great. Thank you for jumping in the chat there. Perfect. This guidance will not change in cold weather, other than the fact that recess and things where you're going to be doing cold activities might change just from your school policy. So no recommendations will change at all, other than you might not be able to open a window because it's so cold outside is kind of the downside to the cold weather once we start hitting it.
And would you recommend we have kids outside in the afternoons in tents and just classes? Would you recommend that the challenge is then you're getting into the cold season. Is it still good to get the ventilation even in the cold weather?
So, I mean, you all know the threshold for how cold it would be to keep kids outside in a classroom setting. We love the tent learning. It's a great option. It definitely decreases the risk of transmission, but understanding that we live in Northern Virginia and in a month or so, it will be probably too cold for that. That is completely understandable and something we can't control, of course, right? We don't live in Florida, unfortunately, or fortunately, I don't know, however you want to look at it.
And then one question, I don't want to take everybody's time, but the whole transmission thing, I've had a parent recently ask me about the aerosol, the thing you said the CDC is now researching, and
Yep.
they were asking about air purifiers. That's what I took from what you said is that may come out with a new recommendation, but right now there's no recommendation about that.
No recommendation for air purifiers or any sort of special air handling in classrooms yet. That will all come out of the CDC shortly. Right now they're in the research stages. So usually it goes, they do a lot of research on it, and then they develop their guidance surrounding it or change their guidance surrounding that research.
Gotcha.
Yep. Yeah. Well, I hope this has been beneficial for all of you. We definitely keep up the lines of communication between us. As I said, we're a partner to you guys during this. If you think of any questions after this presentation or after we send you the email with these slides, recorded slides, please reach back out to us. Let us know if you need anything else. Good work, and we'll get through this all together. So thank you so much for your time. But we do have there is a Q&A from a previous presentation that we were a part of. We will be sending that additionally with these slides, so you can kind of answer, so you can see answers to commonly answered questions over the last month or so. So we will share that as well.
And we just want to thank you for this has been wonderful. And so on behalf of all of us, I just want to say thank you.
Excellent. Well, I'm glad you guys appreciated it. Good work. And I'm guessing you think we hopefully will not be talking soon, but inevitably, I'm sure we will be talking soon. So thank you so much. Have a great rest of your day, everyone. I know, I'm gonna mute.